With us is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hey, Ray.
How are you?
I'm really good. How about you?
I'm doing well. Congratulations on your Hoban Knights, my friend.
Yeah, that was so much fun. 29th season for me.
Yeah.
Long time I've been there, but really a lot of fun because you see the kids grow up so much in the course of a 2.5, 3-month season, from where they are in the summer and how they come together as a team, and then for all of it to culminate in something like Ohio Stadium and a win. It was just fantastic.
Yeah, it looked like a lot of fun. Where do you want to start today?
A couple things. People have been asking me, we hadn't covered, an injury that occurs in the NFL that we use as a jumping off point, an injury called turf toe. Julio Jones, I guess this is more for some of those fantasy people. He's the best fantasy wide receiver. He's going to be limited this week by turf toe. But people ask me kind of, what is turf toe? And we talked a while back about overuse injuries. We talk a lot about those because that's what we see here. Overstress, overuse injuries to the big toe, like stress fractures, or there's these two small bones in the great toe called the sesamoid bones. This is not an overuse injury. Turf toe is generally a twisting, jamming, a traumatic injury to the big toe, and just like other joints in the body, there's ligaments that hold the bones together. And these pretty strong ligaments in the great toe, when they get torn, that's what turf toe is, and that's why it often lingers, and it's an injury that people know, really, really concerning problem. I mean, we talk about Julio Jones. We talk about probably one of the greatest linebackers of all time from this area, Jack Lambert, having turf toe and it ending his career. So this is really a significant problem, and we see it a lot in the high school setting. And so kids will, sometimes with more mild turf toe, they'll tape the great toe, or will actually put an insert with a stiff great toe in there to give the great toe some support so they can push off. But every time they walk and push off, it hurts, it's painful, and it's very hard to continue to play. And a lot of kids end up missing a significant amount of time with this ligament injury known as turf toe.
It also ended the career of Deion Sanders.
It did.
If you remember.
You're right. Talking about the history of sports, Deion Sanders, and so pretty common in high school players as well.
I did not
Another
realize
thing that is kind of one of those terminology things in sports medicine that I wanted to mention today is when it comes to our good friend J.R. Smith. So J.R. Smith has been struggling almost throughout the year, and after he signed the contract and came in a little bit late with some knee pain, and it really culminated the other night with an injury which had him come out of the game. And so this has been kind of on and off for a while, so the reports are that he had an MRI, and the MRI came back yesterday saying no structural damage. So a lot of people, and in my office too, many young kids, we get an MRI and we're not sure if it's a structural problem or a functional problem. What do we mean by that? Well, so we have to get an MRI to know that. But structural problems, Ray, let's take, for instance, the knee, are things like torn ligament, torn cartilage, where a structure in the knee is actually disrupted or torn. A functional injury is something, there's not any damage to any of the structures in the knee, but when young people functionally are running and cutting and jumping, they have pain in certain areas of the knee, like runner's knee is under the kneecap, or jumper's knee is the tendon below the kneecap that we talk a lot about here, because we see it a lot in a sports medicine clinic. In fact, we see it a lot more than we see structural injuries. So that's a functional injury, where when you run and jump and play sports, the knee rubs and irritated and sore and swollen, and that's functional. Structural is when there's something torn in the knee that may need to be fixed. So that's JR. The good news is that it's not something structural. So they say it's kind of week to week. But when he does get out and play, he's having pain with it, and he'll undergo some treatment and perhaps some medicine and some hands-on modalities like ultrasound and stim treatments in the physical therapy unit there. They may be doing some massage on his knee and other things with functional injuries, but he doesn't need to have surgery to have something fixed. And that's the difference between structural things that we're looking for when we order MRIs in sports medicine.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, well documented, and you've talked about it on this show, Joe. Concussions in sports and a lot of it has been linked with football. I was watching some sort of special on one of the news channels just 2 days ago where there were certain groups trying to, quote, outlaw high school football because of the concussions. And concussions do occur in football, but other sports as well. I mean, let me ask you this from the sports medicine standpoint. Are you seeing, what do the numbers tell you, a drop in high school football at all? Are you still seeing the same numbers, better education, better equipment? Where do you see the sport?
Yeah, it's interesting because you mentioned at the beginning about being down at Ohio State, and after the game, they have this gentleman running over to me, jogging over, and it's Dr. Ross, who's the head of the Ohio High School Athletic Association. He's been in my office before. He says, Dr. Congeni, I'm hearing our biggest number going up is girls soccer. We've really had an increase, a spike in the last 3 years, so they're looking at numbers, and they want to do a research study. He said, would you come down in January, and let's look at a research study with female athletes. The study from a couple years ago that I quote a lot, that the fastest growing is girls basketball and girls soccer. So those two, it's not just a football thing like you said. But looking at the numbers are very difficult if you just look at raw numbers, Ray. You know this. We've talked about it. Is because there's heightened awareness, we think we're picking some up that maybe we didn't see before, and we're doing a better job identifying those. You know that they're kind of tricky, and people play through those and other things, play through concussions. But overall, as far as the raw numbers are concerned, there seems to be a little leveling off in football, whereas there is some increase in other sports. And I think you hit the nail on the head that with all the discussion and awareness, people are becoming aware of these sooner. Now, are there some that still fly under the radar? Absolutely, no question. Most studies seem to show as high as 40% are not initially identified. So there's a lot of these that you don't see early on, and the athlete or the coach doesn't really know exactly what to look for, or it's so subtle that it's hard to pick up. And so the numbers are a little bit skewed in that way of, are we better at picking them up? So we're seeing more and issues like that. But overall, football seems to be pretty steady. We're not seeing a continued increase, but the issues are that football is still the highest in total number of what we see. But other sports are growing. Girls soccer, girls basketball, lacrosse is growing. Some of those are increasing, and some of it is due to the increased awareness.
All right. Thank you, Joe. Great stuff this morning, as always. We'll catch up with you next week.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live this